This video will be about type 1 diabetes. Now we're all busy, things to do, people to see, and places to go. To make this happen, we need fuel. One of the best fuels is sugar. We obtain sugar from food. The food is broken down in the digestive system into separate pieces. One of those pieces is the sugar molecule glucose. Glucose moves out of our digestive system and into our blood vessels. There, the glucose is transported throughout our body. Finally, the glucose moves from the blood vessel and into one of our cells to be used as fuel. But what if the glucose can't? This is the problem that patients with both type 1 and type 2 diabetes face. Let's take a better look. Here's an imaginary cell, and here are glucose molecules. And here's a tube. Glucose molecules go through the tube and enter the cell. Now then, this tube is not always open to the outside. Usually it's in the cell. It comes out when insulin tells it to. So where's the problem with type 1 diabetes? The problem is that insulin never shows up to get the tube out. This begs the question, where does insulin come from? Insulin comes from the pancreas. The pancreas, like every organ in our body, is made out of different groups of cells. One specific group of cells in the pancreas are the beta cells. Beta cells release the body's insulin. So what's the problem? Autoimmune disease destroys the beta cells. Let's elaborate. We all have white blood cells in our bodies that protect us from germs. In type 1 diabetes, the white blood cells think the beta cells are germs, and they respond accordingly. Over a period of several years, the immune system attacks the beta cells, until 90% of the pancreas's beta cells have died. Unfortunately, people can have no warning signs until the disease reaches this point. What causes this? Why are the white blood cells attacking the beta cells? Now, because autoimmune disease is complicated, I will be making another video at a later date. For now, I will cover the factors that increase someone's risk of developing type 1 diabetes. Overall, 0.3% of children in the United States develop diabetes type 1. Recall that type 1 diabetes is an autoimmune disease. Research has shown that if someone has one autoimmune disease, such as those listed here, then they are at greater risk of developing another autoimmune disease. I want to discuss age. Type 1 diabetes can present at any age. People mistakenly believe that only children develop type 1 diabetes. That's because 99% of pediatric patients with diabetes specifically have type 1 as opposed to type 2. However, 25% of people who are diagnosed with type 1 are older than 18. Family history. Research has shown that anywhere between 5 to 10% of patients with type 1 diabetes have a parent or sibling who has it as well. If it happens that both parents have type 1 diabetes, then there's a 30% chance the child will have diabetes as well. On that note, let's bring up genetics. If one identical twin has type 1 diabetes, then the other twin has a 50% chance of having it as well. Recall that with having a non-identical sibling, the risk is 5 to 10%. Here, I have listed two specific genes. 90% of people with type 1 have at least one of them, but only 40% of the US population as a whole has it. In other words, these genes are more common in people with type 1 diabetes. This third gene is interesting. 20% of the people in the US have this gene, but only 1% of people who develop type 1 diabetes have it. This shows that there may be genes that prevent people from developing type 1 diabetes. Okay, one of the things to learn from that genetics slide is that a person's genes are not enough to cause type 1 diabetes. Otherwise, How could only one of two people with the same exact genes develop diabetes? This leads us to the next topic, the environment affecting the immune system. Before proceeding, I want to make the note that everything coming is an ongoing area of research. First, the hygiene hypothesis. Research is showing that an increase in type 1 diabetes is due to a decrease in early infections. But then there's this. Research shows that 39% of children with type 1 diabetes have blood tests showing viral infections. This is higher than the versus only 6% of non-diabetic children. Cow's milk, a component of cow's milk introduced before the infant is 9 months of age. Omega-3 and vitamin D. These are believed to decrease risk by reducing inflammation. Difficult pregnancy, meaning these factors pertain to the mother, age older than 25, high blood pressure, high blood sugar, and prolonged delivery. When I upload my video on autoimmune disease, you will learn that among these, virus infections is the most relevant risk factor. Through a concept called molecular mimicry, the white blood cells are mistaking beta cells for a virus they attacked earlier. That finishes the risk factors. Now onto the signs and symptoms. Remember that these will appear when 90% of the beta cells have died. First off, the patient is going to be urinating a lot and therefore will be drinking a lot. Why is this? Normally, the kidney does not allow glucose to be peed out. However, in the diabetic patient, the amount of glucose is so high in the blood that kidney lets the glucose be peed out. Flushing all that glucose out of the body uses up a lot of extra water. This explains these symptoms. Now, recall the whole point of sugar in the first place is to serve as fuel. Without insulin, the cells cannot use the glucose and so they starve. And so, the next symptom is increased appetite. But don't forget, the cells cannot get access to this food. And so, the patient loses weight. Some other symptoms include blurry vision and dizziness. Regarding long-term dangers of type 1 diabetes, I cover most of them in my other video. There is a unique danger with type 1 diabetes called diabetic ketoacidosis. I will make a video specifically for this disease. Regarding diagnosing type 1 diabetes, I cover most of them in my other video. But there are specific labs we get to diagnose type 1. For example, we want to see if the body is able to release insulin, because remember, in type 1 diabetes, 90% of the beta cells are dead. We do this by measuring a person's insulin before and after glucose is added to the blood. We can also do genetic testing for the genes mentioned earlier. Lastly, we are able to identify the autoantibodies in the blood. These are the weapons the white blood cells use against the beta cells. Regarding treatments of type 1 diabetes, I cover them in my other video. But there are some treatments for type 1 diabetes, but not type 2. Remember that the problem is that the beta cells are being killed off by the immune system. We have medications that suppress the immune system so we can save the beta cells. In addition, for any inflamed beta cells that are still alive, we can provide anti-inflammation to restore them to peak insulin-producing potential. Lastly, I wanted to mention this website. It has resources for those who have been impacted by type 1 diabetes, in case any of you are interested. I will have the link below in the video description. As always, thank you for watching.